Good afternoon. We are going to talk about the Colombian health system compared with another systems around the world.
Healthcare in Colombia refers to the prevention, treatment and management of illness and the preservation of mental and physical well-being through the service offered by the medical, nursing and health professions in the Republic of Colombia. Tropical diseases are important issues in Colombia and major causes of death. Malaria affects near 85% of the national territory, mainly the Pacific Ocean coast, the Amazon jungle and eastern savannas, with an estimate of 250% cases in the year. Yellow fever and dengue fever are major public health concerns due to their high epidemic potential, high mortality rate and wide distribution of Aedes aegypti. The Colombian government develops vaccination campaigns against yellow fever on a regular basis. Urban and rural residents experience significant difference in access to health care. The coverage in the three largest cities, Bogotá, Medellín and Cali, was almost 90%. At the rural level, the best services were delivered by the departments in the coffee-growing areas. At the bottom of the scale, in terms of quality and coverage, were the rural areas. In the non-Andean regions, as well as the marginal neighborhoods in medium sizes and small cities. What happened with the Law 100 of 1993 in Colombia? The national constitution was reformed in 1991, and with this purpose, the general system of social security was reformed with the implementation of Law 100, that extended gradually the health coverage in the population. But the economic resources to finance this reform were insufficient, causing collapse of many public health institutions and affecting the income to the medical staff. The general principles of the law determine that the healthcare is a public service, which must be granted in conditions of proficiency, universality, social solidarity and participation. The Article 153 of the law determines that the health insurance must be compulsory. The health providers must have administrative autonomy and the health users must have free choice of health provider. What is SISBEN? SISBEN is the system for the selection of beneficiaries of social programs. In Spanish, el Sistema de Selección de Beneficiarios para Programas Sociales. The National System of Identification of Beneficiaries for Social Subsidy classifies the people according to their socioeconomic level into 6 strates, being Stratum 1 homeless people and extreme poverty, and Stratum 6 the highest level of affluence. Most of the social subsidies and public health programs are focused in the 1 and 2 strates. So, the fraudulent expedition of low-level SISBEN carnets is a major problem in the healthcare system, since the regional politicians are often accused of providing these carnets to not really poor people in exchange for votes. This wrong identifications of beneficiaries prevents the real poor people from receiving the subsidies designed for them. What is EPS? The National Health Superintendent defines which organizations may qualify as EPS, according to a number of requirements, including infrastructure, capital, number of users, functionality, and covering. The function of the EPS is to sell health service packages to the public and contract such services with the healthcare providing institution. What happened with the health professionals and the healthcare system in Colombia? The health professionals had little or no participation in the development of the reform to the healthcare system. So, basic principles such as cost-benefit, healthcare quality, and implications in the professional health practice were misjudged. The reform of the health system restricted severely the opportunity of the health professionals to hire the service privately, phenomenon that caused a heavy loss of income for the average health practice.
What happened, doctor?
You are very good, but you don't have EPS.